Hello, I'm Subramaniam from SumanTV. Indian pharma industry has been helping Indians for years together. However, Indians' lifestyle and food habits changed drastically. That is making so many people suffering with the lifestyle disorders. And still, pharma industry is protecting everybody like a mother. And today, I have Seshiranjan sir as our guest, and he has more than 30 years of experience in pharma industry. He helped for so many companies to build the pharma products from zero to crores of brands. And thank you very much, sir,
Yes, Subbu.
for coming for our show today. Sir, the query is,
Yeah.
this is a general perception or understanding, obese people will have more blood pressure and lean people or a proper body mass index people will have controlled blood pressure. If it is true, why it is so? And what are all the differences between these two? And what is the basic mechanism between these two things, sir?
Yeah, so thanks a lot for having me on SumanTV
It's our
platform.
pleasure, sir.
Now, it's a very good question,
Yeah.
and because obesity has become an pandemic,
Absolutely, sir.
right, and indeed it is increasing, and
Yeah.
so is blood pressure.
Yeah,
Now, let us have very simple understanding.
yeah.
Your heart was made for supplying blood to a specific body type,
Okay, sir. Okay.
to a specific body weight.
Yeah.
So, obesity means the number of cells are more in your body.
Okay.
And which kind of cell? The fat storing cells, adipose tissue, which we call.
Okay.
So the number of fat depots have been increased.
Okay.
Now, your heart has to work very hard to supply to those increased number of cells.
Okay, you mean to say
Yeah.
the obese people are having more fat cells in the body.
Yes.
Generally, heart is made in such a way, it is supposed to supply the blood pressure, blood
Yeah.
to some amount of cells.
Correct.
Since we increase the fat cells more,
Yeah.
now heart has to work so much so that it can supply the blood to these excess fat cells also.
Yes. So what
Okay.
you are doing? You are putting heart under pressure.
Okay.
So if you put heart under pressure,
Hmm.
all the pipes connected to your heart, that is blood vessel,
Yeah.
will feel the pressure.
Yeah.
Pressure flows, blood pressure goes up. Very simple.
Oh, very
Right.
simple, sir, it is.
Now, second thing,
Yeah.
which is more dangerous,
Yeah.
usually in obesity, the visceral fat increases.
Yeah, the
means
stomach fat.
in your central area.
Yeah, yeah.
Now, please understand.
Yeah.
God has very nicely, nature has created the human body contour.
Yes, sir.
Now, this visceral fat is putting a lot of pressure on the kidneys.
Okay. Okay.
And there will be fat deposition around kidneys also.
Okay. Okay.
Now, you can see
Yeah.
when you go to the mutton shop, lot
Yeah.
of fat is around the kidneys of the goats.
Yeah.
Though they are very lean creatures.
Yeah. Yeah.
Not
yeah.
like human.
Yeah.
Just
yeah.
imagine.
Yeah.
So that affects the kidney's ability to manage sodium.
So you mean to say that, sir, this excess fat around the kidneys also trouble the kidney
Kidney
normal function also.
its ability to normally regulate blood pressure
Blood
goes
pressure.
down.
Okay. That is how it is linked actually.
Yes.
Okay.
And
okay.
that is going to alter the blood pressure.
One way you are saying that heart is under a lot of pressure to supply blood to all these excess
Yeah.
fat cells. Another way, when we have visceral fat more, which is covering the kidneys more, and it is also troubling the kidney function also to manage the blood pressure.
Right.
Fantastic, sir. Okay.
Now, Subbu, third very dangerous thing that this obesity is mostly outcome of two things. First is insulin resistance.
Insulin resistance. Okay.
Means you whenever you take glucose or anything which is carbohydrate, like
Yeah.
your staple diet, like rice or chapati
Yeah.
or idli or whatever.
Yeah.
So they have carbohydrate,
Correct.
and that needs to be utilized in the body.
Yeah.
Usually in obese patient,
Yeah.
the desire for taking food will be more,
Generally high.
right?
Yeah.
Usually, so there is a sense of satiety.
Yeah.
So there is a hormone which regulates that your body should not take more than this quantity. You will get this signal,
Okay. Okay.
right?
Yeah.
Once you become obese,
Yeah.
this signal mechanism goes out of the track.
Okay.
It happens because of a hormone
Yeah.
called leptin.
Leptin. So, sir, you mean to say, for my understanding, when obesity is very high,
Yeah,
the signal hormone called leptin,
yeah.
it will not be in a position to give a message
Proper
to me
signal on the right time to your brain, to hypothalamus, to
saying
shut
that
down
control
food
your food intake.
Yes.
So it will not function properly.
Yes.
And that is the reason these obese people will have more craving for food.
Food.
Oh, fantastic.
So now these people will have more craving.
Yeah.
They will have more food.
Yeah.
Now this food is not able to get utilized by the body
Okay.
because there is no exercise.
Yeah.
That is why they have become obese.
Yeah.
Now this will give to a very unique situation when
Yeah.
there is more sugar
Yeah.
and more insulin in your body.
Okay.
So hyperinsulinemia and hyperglycemia.
Oh.
You may not be diabetic per se,
Okay, sir. Okay.
but when doctor does this basic test like glucose tolerance test,
Okay.
he will be able to tell you that you are having hyperinsulinemia
Hyper.
and glycemia.
Okay.
Now, because of high body weight, your heart is under pressure.
Yeah.
Now, this hyperinsulinemia and hyperglycemia
Yeah.
will make your blood vessels stiffer.
Acha.
Now, there is a double whammy.
Okay.
One side, heart is putting pressure.
Yeah.
Another side, blood vessels. So, both pump and pipe has gone out of order. You are definitely going to have hypertension as a bigger problem.
Okay. So this is the logic, sir. And other way, as you said, that kidney is also not in a proper condition to cooperate with heart actually.
Yeah. So, there are 10 factors how obesity will affect hypertension. One factor which we often, most of the obese patient will have sleep obstructive sleep apnea,
Okay.
because the snoring has become very common.
Yeah.
Right.
Particularly in obese people.
A very simple sign, your sympathetic activity is very high.
Yeah.
And your body is not, and people will have a very difficult, because sleep apnea itself is a risk for hypertension. Your
Okay.
brain is not getting supplied enough of oxygen.
Okay.
Your body is not getting
Okay.
supplied enough of oxygen.
That is because of the hardening of these blood vessels.
No,
Okay.
that is because this obesity has caused
Yeah.
there is a issue in the larynx.
Okay. Okay. In the larynx.
Right.
Okay. Okay.
So what happens, because of the changes in the body,
Yeah.
your oxygen going inside, the air going inside,
Yeah.
is producing lot of irregular vibration in
Oh.
your.
So because of that, these noises will come out.
The noises will come out,
Okay.
and this will interrupt the oxygen supply for some time. You may not be aware,
Yeah.
because it will be for brief period,
Yeah.
and this will put your body
Yeah.
under constant stress, even
Okay.
if you are sleeping.
Okay. Okay.
Then once again the parasympathetic activity
Yeah.
will be high.
Yeah.
That will affect your body.
But ideally, during sleeping, stress needs to be controlled in reality.
Reality.
But with the obesity, instead of controlling the stress, we are adding more stress even we are sleeping.
I tell you, Subbu, that chronic stress and obesity,
Yeah.
sure short recipe for hypertension, diabetes,
And stroke.
and stroke.
So you mean to say that, sir, if people are obese and they are stressful,
Stressed as well.
and they have high chances of getting hypertension and then stroke and even
And
diabetes. Oh.
That's
So
correct.
by any means you are saying that having more amount of weight is a very, very dangerous
Very
phenomena.
central obesity. It's very dangerous.
So you mean to say that for everybody, the first thing is to control the
Central
visceral fat.
obesity, visceral fat. First is visceral fat.
I think that could be the reason, sir, if you see the Bollywood heroes and then even Telugu heroes who are above 60 years also, when they don't have this visceral fat and all, they still look very fit and fine.
Yes. So normal human being in society,
Yeah.
but they has to be conscious about what they are eating, how
Okay.
much they are eating.
Okay.
Right. So taking advice from good dietitian
Yeah.
or nutritionist.
Yeah.
But see, our grandmothers knew how health can be taken care of.
Yeah. Yeah. That's true,
Go
sir.
back to the menu of the day,
Yeah.
20 years back,
Yeah.
bring that menu back. You will
Yeah.
not have obesity issue.
Okay.
Work in the field. If
Yeah.
you are not able to working in the corporate, then
Yeah.
spend 2 hours morning jogging and walking.
I'll tell you example, sir.
Yeah.
In my village, my uncle is there.
Yeah.
He is 60 plus years. He doesn't have BP. He doesn't have sugar. Till today, 40 kgs of urea bag, he himself will take and put it on his head,
Yes, correct.
and he can go to the field.
Yeah.
So that is the great gift given by God, particularly for the people who are in the village and doing the workouts. Now being in corporate and cities, as per your advice, they may not have that kind of scope to go to field and do these kind of exercises, but they should allocate time for their body to do the exercises and reduce this fat and keep their body in a proper condition.
Correct.
And
So
if the people who are having lean body, I think these are all going to be reversed, I think, in that.
most of the time, there could be some genetic, epigenetic factor which may make them predisposed.
Okay.
But
okay.
in general,
Yeah.
90%,
Yeah.
obese people have much more complications
Yeah.
and much more risk of developing chronic diseases
Okay.
compared to any lean person.
Okay. So thank you very much, sir.
Yeah,
My dear
pleasure, sir.
friends, Now you have seen our interaction. So please remember, being in city, being in corporate, and then having control on your body weight is very, very, very important. Please think one way. You are running behind the time, you are earning lakhs and crores money, and you are not taking care of your body, and what is going to happen to your future? So please allocate a proper time for your body to have a proper exercises. Please take control whatever you are putting inside your stomach, and have a proper BMI body type, and then avoid having this blood pressure, heart stroke, and this brain stroke and diabetes. So thank you very much for watching this discussion.